Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Tariq. What brings you here today? Okay. Anything more? I'm really sorry to hear about it, Mr. Tariq. It must be very stressful for you. In order to understand your condition, I would ask you a few questions. Is it okay with you? So, since how long you have been, suffering from a cough? 3 weeks. If it is productive or dry, productive. What is the color of the sputum? Okay. If you have cough out blood. Okay. Do you have any associated fever with it? Okay. You are feverish all the time, or fever comes and go? Any particular time in the evening? Okay. Any sore throat? Runny nose? Okay. How's family members at home? They have started coughing. Okay. Mr. Tariq, have you noticed any loss, any muscle wasting, weight loss? Okay. So, Mr. Tariq, I'll ask you a few more questions about your condition. Okay. A few personal questions. Is it okay with you? Do you smoke? Okay. How much cigarettes per day? Okay. Have you ever tried to quit? Okay. And do you drink any alcohol? Okay. And do you have high blood sugars, high blood pressure? Do you know your hepatitis status? Gone through any HIV status? Okay. What do you do for a living? Okay. Okay. If you're married? Okay. Mr. Tariq, if there is any immediate family member suffering from TB, okay, your grandfather, okay. Okay, Mr. Tariq, have you migrated recently? Okay, any contact with some TB patient? Okay, so Mr. Tariq, you told me that you have cough for more than 3 weeks and blood in your sputum, and you are feverish in the evening and have lost some weight, and your family history of contact with TB patient, and you are heavy smoker. Is that all? Or you want to add something more? That's all. Okay, Mr. Tariq, in order to reach my diagnosis, I'll need to examine you. Is it okay with you? Okay, thank you, Mr. Tariq. Can you please come to the couch and take your shirt off? Thank you. And then I'll sanitize my hands and let them dry, and then I'll rub my hands, and then I'll start from the inspection. I'll check for any scar, any deformity. I'll check for the chest movements, symmetrical or asymmetrical, and I'll check the breathing pattern. And then I'll check for the anemia. Mr. Tariq, look up and look down for jaundice, and nose and tongue tip for central sinuses. And I'll check the fingers and nails for clubbing. And then I'll check the pulse, and then I'll auscultate for bronchial breathing at the apex of the lungs and bilateral lung bases. And I'll ask patient to say 99 for vocal fermenters and vocal resonance, and then I'll check the chins of patient for edema, and then I'll thank patient. Thank you, Mr. Tariq, for your cooperation. You can put your shirt on. Can I help you? Okay, and you can have your seat, and then again I'll sanitize my hands. And so, Mr. Tariq, have you gone through an investigation so far? X-ray and any other test done? Okay, Montauk's test. Okay. Then I'll take chest X-ray Montauk's test from the patient, and I'll confirm it name and age with Mr. Tariq to confirm if it belongs to Mr. Tariq or not. And then I'll read them carefully, and then I'll put the chest X-ray and Montauk's test in front of me on table till the consultation is over. Yes, so Mr. Tariq, there is a suspicious shade over the apex of lung, which could be due to tuberculosis, but we need to examine your sputum for the presence of TB germ called Acinetobacter bacilli in order to confirm TB. Is it okay with you? Yes, Mr. Tariq. So your sputum will be tested for 3 times. If first 2 samples did not show presence of Acinetobacter bacilli, okay, if it makes sense to you. Okay, yes, and then if you found the Acinetobacter bacilli in your sputum, then we'll advise culture sputum, but we have to start treatment of TB, and we'll confirm the diagnosis with Acinetobacter bacilli, which takes 2 to 3 weeks. Okay, and you don't need not to be worried, Mr. Tariq. The good news is that effective and curative treatment is available for TB, and person can become normal healthy in 6 months. Okay, but it needs the commitment. Starting TB treatment is a big responsibility for both doctor and patient, and this treatment was taking of 3 to 4 antibiotics for a period of 6 months early in the morning with this empty stomach. Okay, and all these antibiotics have potential side effects as well. Okay, but yeah, for I'll be referring you to the chest clinic for start of treatment if your Acinetobacter bacilli culture will be positive. Is it clear to you? Can I repeat it again for you? Okay, so if we'll start TB treatment, then you should know some safety nettings, that if you develop any red color urine, then rest assured that the color it is the color of medicine, not blood. Okay, and if you God forbid, if you develop any vision problem or joint pains, so please you have to report me or your chest physician. Okay, and then we'll decide if we need to alter the medicine or stop the medicine. Is it okay with you? And yes, most importantly, Mr. Tariq, your wife and kids will be screened for TB infection with chest X-ray and Montauk's test. Do you understand so far? Okay, Mr. Tariq. So here is an important note that it is important to take medicine regularly on time, and you need not to comply with taking of regular anti-tuberculosis drugs, and complications like resistance to these 4 medicines can occur as a result. The treatment can become difficult and more expensive. Okay, so you need to be careful about it, and if you'll not take the medicine on time regularly, then direct observation treatment will be started, in which you'll be dispensed and taken under direct observation of health worker. Okay, and here are some life changes I will encourage you to imply. Okay, you need to adopt that. As you know, this disease is spread by air, so you need to wear mask for 2 weeks after the start of medicine, and when you will no longer remain contagious. Okay, can you do it for me? Okay, and Mr. Tariq, do not spit everywhere. Please spit in a small pot with a cover lid and wash it out in the flush. And can you do it? And take healthy diet, which should include plenty of meat, fruits, vegetables, and dairy products. And can you manage it? Okay, you need not to be worried, Mr. Tariq. I'll be referring you to a social service who will ensure healthy diet for you and your family. Okay, and please keep the window curtains open so the sunlight and fresh air can enter the rooms. Okay, is there anything you want to discuss with me? Is everything clear? Can I repeat it for you? Okay, so Mr. Tariq, it is here is a leaflet. It includes all the information regarding tuberculosis. I hope it will be helpful for you. and I wish you a speedy recovery. Take good care of yourself. Bye bye.